Good morning, everyone. The next meeting of the Board of Health will be held on Friday, June 24th, 2022 at 8 a.m. in the Selectmen's Meeting Room at the Richard D. Carney Municipal Building located at 100 Maple Avenue, Shrewsbury, Massachusetts, 01545, at which time and place the Board of Health will consider the following agenda. So I'd like to call the meeting to order. And the first item on the agenda is the review and approval of the minutes from the May 20th, 2022 Board of Health meeting. Do I have a motion to approve?
So moved.
Second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. The meeting minutes are approved. The next item is to review and discuss guidance, first offense permit suspension, sale of tobacco/vape to a minor. And we have, is it Sherry Tangri from Worcester to discuss this issue?
Cherry.
Cherry.
Cherry Tangri, Tobacco Inspector for City of Worcester.
Would you like to
Cherry, do you want to come up to the mic?
table?
So Cherry Tangri, Tobacco Inspector, City of Worcester. So as per Massachusetts General Law, Chapter 270, Section 6, there is a mandated suspension for the first violation, and the suspension is between 1 and 30 days. So the board is required to set and vote on a number of day, and this just needs to be approved during a Board of Health meeting. There is no requirement of this being published as a summary in the newspaper. And the next time the board amends their regulations, we can put it in the regulations at the time. So I have some data with me. The city of Chicopee chose 1 day as the number of suspension they want to give for the first violations, and the most popular is 3 days. So the city of Boston, Chelsea, Everett, Gloucester, Peabody, Revere, Salem, Somerville, they determined 3 days, and the towns of Uxbridge and Essex also 3 days. And 5 days was determined only by the city of Melrose and town of Wakefield.
Okay, so at this point in time, we're here to have the board select a number of days of a suspension for a first offense.
Yep.
So as it stands right now in our regulations, I think the Board of Health has discretion on whether or not to suspend a license. So this is mandated by a state regulation?
So this is only for sale of tobacco to a minor.
Okay,
Yep.
okay.
Mr. Chairman, can I just say a couple?
Sure, go ahead.
Cherry, well, I could say through the chair to Cherry. What is the status on what the Alliance communities are doing? I know that I've seen emails that you've sent to different communities, and we did have this conversation with the Worcester Board of Health. We're not quite there yet. We're going to circle back. But can you give an update about where folks are at, just and what they might be considering?
So Grafton recently determined 3 days, and next time whenever they update the regulations, we will put it in there. But for now, they have voted for 3 days. And Worcester, as Karen said, we are in the process of determining the days. West Boylston chose to determine on a case-by-case basis. So they did not select a set number of days. And Millbury, we are still in conversation. And here we are, Shrewsbury.
Okay, any discussion from the board? Do you have a feeling about whether or not we should set a number of days, like 3, for example, or?
The larger majority of boards have said 3 days. I'd be comfortable with 3 days for the initial offense.
As would I.
Okay, I would be comfortable with that. I mean, it's reasonable. I mean, it's up to 30 days, which seems rather harsh. So I think the 3 days seems
For a first offense?
like, for a
Yeah.
first offense, yeah. Okay.
Do we know what the second offense garners?
I
in
don't-
So
terms of
it's
penalty?
2000. So here's the thing: the fining structures in the state law it ranges from 1,000 to 5,000, and with the second offense comes permit suspension of minimum 7 days and up to 30 days, and with the with the third violation, it's 5,000 plus up to 30 days permit suspension. But when it comes to sale of tobacco to a minor, there is an exception that the permit suspension begins right with the first offense.
Okay. So in that case, then, do I have a motion to set the the number of days of suspension to 3 days following the first offense of sale of tobacco or vape to a minor?
So moved.
I'll second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Aye.
Debbie Fishman?
Aye.
Myself, aye. Okay, so the motion is approved. Thank you, Cherry.
Thank you.
Thank you.
Thanks, Cherry.
Okay, the next item on the agenda is review and discuss the emergency regulation requiring employers to report positive COVID-19 cases in the workplace in the town of Shrewsbury. Karen, do you have a recommendation in this regard?
So Worcester is still requiring this, and Shrewsbury is the communities in the alliance that are doing this. I'm a little bit on the fence. Obviously the cases are low, which I know we're going to talk about today. I feel like we should still, if people can let us know, I feel like we should still be doing education and having conversations and tracking and supporting businesses. And we're obviously not out of the woods. So even though we're much, much lower in terms of risk, I still feel like it may be something we want to keep in place. I would be interested in what Dr. Abraham thinks, and given his
Yeah, I agree for the
infectious
same
disease
reasons.
background.
Right. For two reasons, in addition to what Karen mentioned. One, that correct, even though it's low, it's not zero. And concern is that there are newer variants which are slowly gaining ground, for which vaccine is not susceptible, or the virus is not susceptible to vaccine. And number two, this is our only means of some data, because home tests are not reported at all. So we have no way of estimating prevalence or if there are outbreaks. So from a public health standpoint, hospitals are required to report data when they test positive on anyone who walks through their emergency room or otherwise. And so same way, this is the only way to get at least a snapshot, even though we recognize that it's an underreporting because home testing is not captured at all. So, but at least we know some data as opposed to none. So I strongly second Karen's sentiments.
Has there been any indication from the businesses that it's any kind of a burden to them, or it's not a significant issue for them?
Not to,
No,
I mean,
I can speak to that. I can tell you the Shrewsbury businesses have been phenomenal about calling me, emailing me, or whatever. And if they have questions, they always know that the public health nurse team is available to ask questions or guidance or get any new information. So they are very comfortable in doing that. I can tell you they've been great, and it's very helpful.
Okay.
I
So,
mean, we're still almost 10% positivity rate, right? For the past 2 weeks? It's just under.
well, this is I don't know if you have this is the information that we provided last Friday. The challenge is, unfortunately, I know you folks usually meet early on Fridays. Some of the information that we provide on our Friday report outs doesn't come from the state until late Thursday night, and then our folks have to get all that together. So this is why we have last week's information here. And I'm really having a hard time seeing.
It's
9%.
9.08.
Yeah.
Oh, thank you.
9%.
There it is. Wow. Clearly need my bifocals. It's really scary. So, yeah, I mean, we're not, and certainly Dr. Abraham, being an infectious disease expert, can talk about this better than I can. But, we have been following, the CDC has a really nice tracker, right? I think it's really clear to find, and anybody can go to it any time, and it's by county. So, You know, Dr. Hirsch, who's our medical director, really felt strongly, you know, for Worcester and the Alliance, and certainly Shrewsbury, that until we saw that to be
Yep.
low, which we now see, that he really felt strongly we should keep the mask advisory in place. Am I skipping around? I'm sorry.
Yeah,
We're talking about businesses.
Oh, yeah, sorry about that.
we'll get there.
So anyway, so that's great, Kerry, that they appreciate that. Getting ahead of myself.
Okay, so it seems it's the consensus of the board that it's wise to maintain the reporting requirement by the businesses.
Yeah, I mean, basically, and people will, you know, contact her, obviously, but in Worcester, it's just, they send a quick email just to say, just to let you know, we have 3 positive employees. I mean, it's just a quick, and then we follow up with them.
Okay,
So
so that will stay in place then,
that's great.
okay?
Yep.
So the next item on the agenda is to review and discuss the Shrewsbury Board of Health Mask Advisory.
So about that,
Yes.
so, you all had kind of modeled after what the Worcester Board of Health / Dr. Hirsch had put into place, which, again, it wasn't a mandate, it was an advisory, which was basically calling out on paper or, you know, social media, that there always was an advisory. So it really wasn't that we created something, we were just sort of calling it out. So it's obviously not something that you have to, unless, I don't know, per protocol, you have to rescind it, because it's just a advisory. We didn't put anything into place, we just said, so I think now that it's low, I think if something is gonna be said about like rescinding the mandate, I'm sorry, the mask advisory, we still would wanna say, you know, if you're immunocompromised or, you know, all the things that we would say, which is the same, like you should continue to wear a mask. So I'm not sure how exactly to frame that, because all,
It's not like there's no risk. I mean, there is some
Right.
risk, and I think people have to make that decision for themselves.
Mm.
And I think having an advisory is legitimate, you know?
right,
So you were saying before, Karen, that Dr. Hirsch is still recommending this, the advisory?
well, so we've been tossing this around, like, how, because, you know, obviously folks have been asking, well, now that it's low, what does that mean? And I think to what Jenny just said, it's still not 0, right? So we don't want to say, you know, we're now advising that there's no advisory, because I think we need to continue to say there's an advisory. It's not a mandate. It's not a mask
Right,
mandate. It's
right.
saying exactly what we've all said all along. All we did was just call it out and make, you know, send out information, you know, as a reminder, you know. So I think it should stay, I don't even want to say in place, because it's not a mandate. It's just
Just leave it.
reminding people that if you are immunocompromised or you're at a large gathering, like, there's still, you know, super spreader events. I'm hearing about weddings and other things where people are, even the bride and groom, are still, it's still alive and well.
Yeah.
So I'm not sure exactly how you want to frame this in terms of this agenda item, only that I think we just need to continue to, through our whatever channels, remind people that it's still a possibility to get it, and, you know, clearly remind people that if they haven't gotten all of their boosters and vaccinated, that they should do that. But if they are immunocompromised or, you know, or at a large event, or however, you know, Dr. Abraham might be able to frame it better, that they should continue to think about wearing a mask.
Right. So healthcare settings, it's still required.
Right, that's right.
Right.
Yep.
And businesses can make the decision to require it. But this is, for the general public, an advisory.
Right.
I guess the only difference between what we've done before in terms of advising people, you know, to wear masks indoor if they're uncomfortable, is that there was a document produced, right, that we put out there. So then the question is, do we need to, at some point in time, if we think it's really low and not needed, we need to take the document off somewhere, or
Yeah, Carrie, is
it's
it?
published on our website?
Yeah, it just went out as a news flash, and it was the document
Okay,
that just said that we were advising, so, sometime after this meeting today, we would just give the public an update, because it was an agenda item, and, you know, that it's still the recommendation, it just has to be some kind of just blurb. You don't have to edit the document or
Right.
anything like that.
Dr. Abraham?
So, two things, I completely echo Ms. Fishman and Karen's points, which is our prevalence is still 9.08%, which is, recall we were looking for prevalences as low as 2% or less to say it's extremely low prevalence. This is not low prevalence, number one. Number two, every time you take off an advisory, then put on the advisory, take off the advisory, it creates a mixed messaging to the public. What is it this week? I mean, do I need to, like the weather, do I need to go check to see what the advisory is? I would leave the advisory in place. I wouldn't tamper with it. It's an advisory. That's all it is. Your personal preference, if you feel your health condition or a situation you're in or whatever other reason that you choose to wear a mask, absolutely reasonable. If not, don't. There's no mandate. So I think the only time we really want to change that is if we really think a mandate is necessary, if there's a high prevalence setting. But in the interim, just leave it alone. It's exercise caution at all times. It's the same, like saying wear a seatbelt whenever you're in a car. You don't have to remind people to do that. That's sort of the baseline. So I would recommend we just leave the advisory alone, don't do anything with it, because the prevalence is not zero, as Ms. Fishman pointed out. So we still have risk of acquisition of disease.
Okay, yeah, I'm fine with that. Okay.
Yep.
Thank you, Karen. Thank you, Dr. Abraham.
Thanks.
The next item is to review and discuss the coronavirus COVID-19 update.
I think that was it.
Is that, I think that was pretty much it.
You want my cheaters?
No, but I'm really discouraged by how I can't see, and this is not even tiny, tiny print. So I guess the only thing I would say is, now we're looking at vaccinating PDs. So that, I think, is a different, obviously, anybody who's doing that, and we have some clinics set up in Worcester. There's a contractor with Mass DPH that's coming out Sunday to the YMCA to do some clinics. Really focusing on like vaccine equity clinics. But we're really encouraging, folks to take their really young children to, their pediatricians. And we are a vaccine hub in my office, so we're trying to order some of this vaccine and have it available for pediatricians, because they don't always want to order it, and they don't always have the right equipment to store it. So, and they don't want large quantities, so we're able to just give them, vials here and there. So we're really encouraging that. But there are probably going to be some clinics, at least in Worcester, but we're just recommending that, obviously, whoever is eligible in this very young category get vaccinated if possible.
Yeah, so that was obviously a very major development
Yeah.
since our last meeting. And it can only help the situation in terms of reducing spread. 'Cause the children will not be spreading it nearly as much as
Right.
possibly before. Okay.
So it's Moderna, right?
Both.
It's
Yes.
It's
both.
both of them? So are both available now for under 18?
So the Moderna between 5 and 12 is not available in Massachusetts, as I understand it. For reasons I'm not exactly sure why, but otherwise everything is available from 6 months upwards for both Moderna and Pfizer. Pfizer is a 3-dose series, for Moderna is a 2-dose series.
Okay.
Thank you.
Okay. I think that's the update.
Yep, that's it.
Thank you.
Onward.
Okay, the next item is to review and discuss the Central Mass Regional Public Health Alliance updates. And I think we have Micah Blondeau on the phone.
Yes. Can you hear me?
We
Yes.
can hear you.
Okay. It's been largely business as usual. We have a couple of new restaurants that are in the works. that should be opening relatively soon, as well as the Market Basket, still waiting on a final date when that's going to be up and running. But other than that, everything has been kind of status quo.
Okay, so no special occurrences to report then?
No.
Okay. Okay, any questions from the board, concerns?
Any concerns about food safety as we get into summer? That's always food left outside on vending trucks, et cetera, not properly stored or refrigerated. Any events that we should be concerned about?
Yeah, I've been trying to kind of keep a closer eye on the restaurants just because they have so much staff turnover. So there are events where food is uncovered, but normally people are still doing a pretty good job with the temperature control and things like that. And we inspect all of the food trucks and kind of try and stay on top of that as well. The other concern is just now with summer, I'm starting to see more pests, insects, and things in the businesses, so trying to keep them on top of that as well.
And I would just say too, I believe, I'm sure Carrie will know this, I think we do like food safety tips on the
Yes.
website, like
Yes.
around like, hey, if you're having a barbecue,
Yep, we'll be
you know,
sending
don't
that
leave
out
that
again.
potato as like our mother tried to kill us when we growing up. Things were just left out for a really long time. We just didn't have that awareness at the time. And look at how great we turned out.
When you look back, there's a lot of things that, like, really?
Right.
We survived?
Right, like no seat belts, no bike helmets. Yeah, it's great.
Yep.
And we haven't had very many foodborne illness type complaints in the last since the last meeting, so that's probably a good indicator that things are going okay.
And I understand there's going to be some mosquito control activity going on soon in Shrewsbury in terms of taking care of the mosquito larvae and et cetera.
Yeah, so the,
Send out monthly spray dates that are all
Yeah.
tentative and subject to change due to weather patterns and conditions, but that's always published, yes.
and I think it's important to note, because there are some folks who are concerned about what is in the spray and bees and all of those things. So the Central Mass Mosquito Control website is chock full of information around that and what they use, and the director is just amazing. I think he just celebrated like 40 years there, and they're all scientists, but they're really fantastic, and they do a lot of education in the community. They also have a tire collection program, which is really important. In fact, we should talk to DPW about pumping that up, just to try to get rid of that standing water in people's yards and so forth. So it's a great resource, and if anybody wants to opt out of having their yard sprayed, they can do that as well on the website.
Okay. Any other questions, concerns? Okay, very good. So that just leaves us with reviewing our meeting schedule for a July meeting.
22nd or 29th
29th would be a little better for me.
will be fine with me.
Let me just double check something.
Sure.
Yep, that works.
Okay, so let's plan on the next meeting for July 29th at 8 a.m. Okay, very good. So in that case, do I have a motion to adjourn?
So moved.
I'll second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. The meeting is now adjourned. Thank you, everyone.
Thank you.
Thank you.
Happy
Thank you.
Thank
Happy
you.
4th.